Have you reached your menopause? Have you stopped bleeding for more than 1 year after menopause? And by chance, have you started bleeding again? This is called as post-menopausal bleeding, and it causes a lot of fear amongst patients and also amongst doctors, because there is a higher risk of developing cancers of the uterus or the ovaries or the cervix in this age group. But you don't have to panic, but you should not neglect either. So you must reach out to your gynecologist. And what do? We try to find out the cause, from where the bleeding is coming and what is the source. Sometimes the body just produces some hormones additionally which causes this kind of a bleeding. Sometimes there are small growths inside the uterus which are very innocent. These are polyps, sometimes there are small fibroids, sometimes there are cancers. So what do? We do some basic investigations like an ultrasound. We try to find out the inner lining of the uterus called endometrium, whether there is anything inside, and if there is an abnormality there, we put in a very tiny telescope inside the uterus. This is called as hysteroscopy, and we may take out a biopsy, or when we find small growths, we take out those growths, and if they are innocent, that is all the treatment that is required. So post-menopausal bleeding, hysteroscopy has to be done, and we have to evaluate the cause. If we find out other significant major causes like large tumors or cancers, the treatment is different. But believe me, majority of the times, very simple hysteroscopy can solve, detect and treat this postmenopausal bleeding. So please don't delay and come to the gynecologist and solve this problem of yours.